Welcome back to the ECG course. This is chapter 3, and in this chapter we're going to talk about the different ECG waves and complexes. So here's a typical EKG rhythm strip of a single lead, and let's just call this lead 2. Okay, I'm going to put lead 2 over here. So this is lead 2, and right now it just might look like some squiggly lines to you, but I'm going to try to give some names to the different components of the EKG. So the flattest portion, okay, I'm going to just kind of draw a line down this EKG, okay, and that line would be considered your isoelectric line. Sometimes we'll call it the baseline. And you'll see that it's wandering just a little bit, so it's kind of a wandering baseline. It's not as straight as we would like to see it. And that can be caused by numerous things, such as patient movement or movement of the EKG wires. But it should typically be pretty straight. So everything on that line would be considered isoelectric, meaning it doesn't have any positive or negative charge occurring. Anything above it would be considered a positive deflection, and anything below it would be considered a negative deflection. Okay, so if you remember what we were talking about when we were talking about leads and how bipolar leads, like leads 1, 2, and 3, again this is lead 2, they have a positive and a negative electrode. And whenever the electricity of the heart is traveling towards the positive electrode, well, it's going to show up as a positive deflection on the EKG. It's going to be above that isoelectric line. And whenever something, or the electricity or the depolarization wave is traveling away from the positive electrode, it's going to show up as a negative deflection. Okay, so this line here is considered isoelectric. The first positive deflection, okay, is called the P wave. So that's your P wave, that first positive deflection. The first negative deflection following the P wave, right there, that little tiny line, is called the Q wave. The next positive deflection, the big large one here, is called the R wave. And then you have another negative deflection right here called the S wave. Finally, you see one more positive deflection right here, and we call that the T wave. It's supposed to be a T there. Okay, and I'm going to go into what each of these different waves are showing us. So here's a picture of the heart, and it's kind of cut away so you could see the 4 chambers. You have over here, you have your right atrium, your left atrium, your right ventricle, and your left ventricle. And hopefully you have some idea of the conduction system within the heart. I'm going to briefly cover it. In the right atrium, you have what's called the SA node. That's this little oval-shaped thing here, the SA node, or the sinoatrial node. And that's sort of the pacemaker for most healthy individuals, which causes this the initiation of conduction at about 60 to 100 times per minute under normal conditions. And that initiates the conduction, which then travels down these different pathways. These are your intranodal pathways. You also have one that comes over this side called Bachmann's bundle that depolarizes the left atrium. And the right and the left atrium both kind of depolarize at the same time. Okay, and this depolarization is hopefully causing contraction. So the electrical conduction within the heart is causing the mechanical action of the heart. Then this conduction travels over here to that little triangular node. It's called the AV node. That's your AV node. It stands for atrioventricular. Okay, and you have a slight pause. And the reason you have that pause is to allow for the atria to eject all of their blood into the ventricles. You want maximum ventricular filling. All right, now that conduction then travels down the His bundle and then to the right bundle branch and the left bundle branch almost simultaneously under normal conditions. And then your ventricles depolarize as the Purkinje fibers and the different cells of the ventricles conduct that electricity. The ventricles depolarize, and then you get ventricular contraction. Well, how does that show up on an EKG? Well, the P wave, that first positive deflection, comes from atrial depolarization. That's where we get our P wave from. So when the atria depolarize, all these atria contract in response to the electricity. Okay, that depolarization wave is the P wave when the atria depolarize. Next, you have your QRS complex. Your QRS complex is always called the QRS complex, whether it has a Q wave, an R wave, or an S wave. The big, deflection following the P wave is called the QRS complex, and that signifies ventricular depolarization. Ventricular depolarization. And notice between the P wave and the QRS complex, you have this flat isoelectric segment. Okay, that's called the PR segment there. We'll talk about that later on. But the reason it's flat is because it's pausing at the AV node. That's the pause of depolarization. Finally, when the ventricles recharge, repolarization, you have, so when the ventricles are all recharging, I'm going to just kind of draw recharging like that, you get a T wave. Okay, so that final wave is the T wave. Now, another wave that I haven't mentioned and you haven't seen yet is called the U wave, and it doesn't always show up, but sometimes it'll show up following the T wave, and it's not completely understood what it's denoting or showing us, but most have sort of committed to the theory that that is repolarization of the Purkinje fibers. So a U wave may or may not be present, and it's just an extra wave following the T wave, and I'll show you some examples when we get into 12-lead EKGs. So again, when we have atrial depolarization, that's the first positive wave on an EKG, it's the P wave. Then we get that little bit of a pause, and we get the QRS complex following that. Then we get another little pause, and then we get our T wave. So atrial depolarization right here, ventricular depolarization, and then we have ventricular repolarization. Well, the P waves coming from atrial depolarization, I just want to kind of note that they can show up as many different types of waves. This first one that's biphasic here, all right, that could be a sign of, it could be normal, or it could also be a sign of left atrial enlargement. Okay, notice how it's biphasic. And I just want to kind of give you some idea of where the P wave comes from. The P wave is showing us atrial depolarization of both the right and the left atrium. Okay? Well, why isn't it showing up as two separate waves? Well, because it almost happens simultaneously, and it is kind of two waves, but see, the right atrium depolarizes first, and then the left atrium depolarizes, and the EKG monitor itself kind of combines those just into one single wave. Okay, so it combines those two waves into just kind of one single wave because they're so close together, it's almost at the same exact time. Now, sometimes it will show the separate atria depolarizing. You'll see the right atrium depolarize and then the left atrium depolarize, and that will happen also with left atrial enlargement, and that's called P mitral. P mitral, M-I-T-R-A-L-E. Again, that's a sign of left atrial enlargement. Or sometimes the P wave will actually be peaked, as it is in this third example here, and that's a sign of right atrial enlargement, and that's called P pulmonale. Pulmonale, P-U-L-M-O-N-A-L-E. P pulmonale, a sign of right atrial enlargement. You may have heard the word cor pulmonale in the past, and that stands for right ventricular failure, or right ventricular hypertrophy is typically a sign of right ventricular failure. And a lot of times those two go together, P pulmonale and cor pulmonale. An important measurement number to remember is 0.12 seconds, or 120 milliseconds. And that's equivalent to 3 small boxes. Now, why is that important to remember? Well, it's important to remember that because the QRS complex should not be wider than 3 small boxes. So this one that I just drew, for example, would be considered wide because you start at the first positive or negative deflection off of that PR segment. Okay, so if we started right about here, I'm going to try to draw an arrow there, right about there, you'll see that there's more than 3 small boxes within that QRS complex. Okay, so typically your QRS complex should be maybe 2, maybe 2.5, maybe 2.5 small boxes, but it should not be bigger than 3 small boxes. If it is bigger than 3 of those smaller boxes in there, it is considered wide. And there's numerous things that can cause that, and we'll talk about that later on when we get into the interpretation. Also, the QRS complex itself, okay, does not have to have, as I said before, a Q wave, an R wave, and an S wave. It could have many different shapes and sizes, but it's always showing us ventricular depolarization. Okay, so as you can see over here in this example, you have this first one would be considered an R prime, 2 capital letters because both waves are large. When you're denoting the QRS complex, smaller waves will have lowercase letters and larger waves will have uppercase letters. And if you have more than one wave of the same type, you'll put that little apostrophe denoting that it's the prime. So this one is called RR prime. There's no Q wave and there's no S wave because nothing goes below the isoelectric line. That is still called a QRS complex. The second one is also an RR prime, but notice that it's a lowercase r and then an uppercase R because you have a small R wave and then a large R wave. Here we have an RSR prime. Both the first R and the first S wave are lowercase because they're smaller. Another RSR prime with a large S wave. Another RSR prime with just a large S wave, and both the R waves are small. A QR, another example of a QR, and another example. And there's many other different morphologies. These are just some examples, just showing you that you don't have to have all the different components, such as a Q wave, an R wave, and an S wave. It could have just an R wave, just a single R wave, and in fact, that's very common. You might not have any Q wave or any S wave at all. But it's always a sign of ventricular depolarization. Additionally, to make things even more complicated, the QRS complex will look different depending on what lead you're looking at it from. The P waves and the T waves will look different also, but the QRS complex is really what stands out the most on an EKG, so that's really what I'm kind of focusing on right now. So, looking at this top EKG rhythm, let's just say that that's the rhythm in lead 1. And this is the very same rhythm looking at it from lead 2. It's just looking at it from a different angle so it looks completely differently. But this beat here is this beat here. This beat here is this beat here, and so on and so forth. Although it looks different, one's almost completely positive and one's almost completely negative, it is the same rhythm. These are the same beats, beat for beat. Okay? And the way I kind of try to help you picture that is if you look at a human being, if you look at a person from the front, you might see 2 arms, you'll see a nose, a mouth, 2 eyes, and so on and so forth. And then if you look at them from the side, from a profile view, you might only see 1 arm, you might only see 1 eye, and so on and so forth. It's the same person, it's just a different angle of view. And that's what's happening here with this EKG rhythm. Lead 2 is looking at it this way, and lead 1 is looking at it this way. Let me give you a little bit more intuition on that. So, if you remember the discussion on leads, you kind of can remember where each lead is looking from. So I'm going to show you a single complex or single EKG rhythm. I'm going to try to draw it from 3 different leads. So let's do 1, let's do 2, and just to make things kind of stand out, let's look at it from AVR as well. So lead 1, if you look up here at this top image, lead 1 is going to be looking from its positive electrode at the left side of the heart. So lead 1's over here, looking at the heart from that side. Lead 2's down here. Its positive electrodes looking at it from that side. Oops. And let me erase that. So that was 1 over here. And AVR is up at the top here, looking at it from the right side down, looking at it that way. All right, and let's try to draw these EKGs pick this color, if the depolarization wave was heading almost directly towards lead 2. All right, let's see how that would look. Well, if I was looking at it from lead 1, It's definitely going more towards lead 1 than away from the positive electrode of lead 1. So it would be more positive than negative. It might look something like that. If I was looking at it from lead 2, the QRS complex would be almost completely positive. It might have a little bit of a negative wave, but it would look mostly like that. And then if I was looking at it from AVR, it would be almost completely negative because that yellow arrow is going almost completely opposite of AVR, where AVR is looking at it from. So that's kind of giving you an example of why the EKG rhythm will look different depending on what lead you're looking at it from. Okay, so in this part we learned what the P wave is, what the QRS complex is, and what the T wave is. And in the next chapter we're going to talk about ECG intervals. Very, very important. So if you want to go back and you want to look over ECG leads again in chapter 2, click on the image on the left. If you're ready to move on to chapter 4 on ECG intervals, go ahead and click the image on the right. And don't forget to subscribe to our channel. Please leave your comments in this comment section below so I can address those. And I will see you in the next lesson.